but this is the world that you're living in right now, right? You got all these different voices, and they're all like clamoring. You're in the middle there, trying to figure it all out and trying to manage all that stuff. So it's all different perspectives, right? Don't ever open the building again. Oh, it's so much better. So I'm sure everybody can relate to this right now, in some way or another. So if I wanted you to know that man, I thought this was something that was so relevant to where you are. And so it's flying around on Facebook and other social media. So I'm sure you can find it somewhere. I would just put this up and say, hey church, this is my world right now, So in any case, we'll kick into this. And in fact, I'm going to ask Dave. Hey, Dave Arnold, would you open us up in prayer today, and even just kind of pray for all the pastors and leaders here, even just given that little graphic that we have up on the screen.
You guys,
sure. Let's pray together. Father God, so many of us, probably all of us, can resonate with that graphic, Lord. That this season that none of us expected to experience. None of us have the experience because this is so new. And we are reminded in such a powerful and profound way of our desperate need for you. And we're also reminded through your word that you are sovereign, that you are in control, that you have given us everything that we need to handle this. And so as we gather together, we just pray that you would really speak to us through this time, that you would just help us to engage one another, to support one another, to encourage one another, to glean the truths that we're going to hear and be able to apply them to our local circumstance. As so many of us, each of our situations is different. So just guide and lead this time to your glory, to our good and growth, and to the advancement of your kingdom. So we just commit all this to you in Jesus' name. Amen.
Amen. Thank you, David. Hey, so you can see here, we've got a whole bunch of people on. We got the chat box going, so make sure you open up the chat. And so I'm really excited about this. I'm going to give this. Alex Rivera was the one who was the brainchild behind this subject today, and so we're going to call this. We've called this "Ask a Doc," insights from doctors, medical professionals on how to create a safe environment for church. And I know that it is a moving target. You guys in California. If those of you who are in California, you just got the news yesterday, I guess, that, hey, you can reopen church now. And so, what does that look like and everything else? And so we're just trying to do the best we can. Our key phrases, our 3 key words as a district for EFCA West have been resource, convene, and connect. So we want to convene us all together because really the best ideas and best stuff come from the relationships here. Resource you as best we can, and then connect you maybe one-on-one to each other as we go through, so you feel like you're not alone in this whole process, because you're not alone. So as part of that, we're just trying to think of ways that we can help you. We came up with this idea to see, hey, can we get some doctors and ask them, what is your perspective on all this? So I'm really excited about, we're gonna have 2 doctors. The first one's already on now, and then the second one will be coming on in about a half hour. But we're catching them right in the middle of their day. So we're going to start with Dr. Steve Lynch. And Doc, this is the first time I've seen you with your white coat on.
Usually, no tie though. It's we actually have a rule here. We're allowed to go without the necktie during the hot months. So, but yeah, the jacket's on.
Okay, so you see, we didn't just hire some guy, from Central Casting somewhere. He's a real actual doctor. He's got the white coat and everything. So, but I want to start off with you, and we'll get a chance to introduce you to our pastors and leaders here, Steve. But Steve and I have been friends for a while. Steve and his wife, Cynthia, who will be joining us soon. And Steve has been an elder at Compass Church in Goodyear, Arizona for a number of years. But Steve is the Vice Chief of Staff at the Cancer Treatment Centers of America in Goodyear, and also works in the medicine department. Cynthia, and we'll introduce her when she joins us in about 25 minutes or so, is the medical director of the breast cancer program, and also works as a medical oncologist at the Cancer Treatment Center of America. And actually, Steve, you told me she outranks you. I mean, those are your words, but is that true?
It's a bit of a conundrum. So in the medical staff reporting, I'm theoretically number 2, though I say that with great modesty. So all the physicians other than the chief of staff report to me, but when it comes to a cancer center, your medical oncologists are your experts. And I was dubbed, my wife is the real Dr. Lynch. I'm the other Dr. Lynch, according to the chief of staff. And it's tough for me to argue that point. It's that or walk home. So I just kind of allow that. But
yeah,
she's the boss.
So, I mean, there's just a lot of firepower going on in that household. So it's good. It's good stuff. But the other thing, what I really love about you guys is the fact that you also have been volunteers at Compass Church as well. So you serve on the elder board, but you also both serve in the special needs ministry that's called Compass Treasures there, and just been faithful servants over the years. And so I just thought, when we thought about, hey, if we got a couple medical professionals to talk to us, not just a person, in a lab coat, working in a lab who only sees things a certain way, but you've got multiple dimensions that you can speak into this from the medical field as an elder, working in the children's ministry, working with kids and even kids with special needs. So I'm excited to hear from you and Dr. Cynthia as well. So can you just start off by just tell us a little bit of a background of what you do and your background, what you do, and then maybe even how this whole COVID thing has affected your work.
Sure. So, so again, my background is in general medicine, and fundamentally, for 20 years, I was what you would think of as a typical primary care doctor. I've done both inpatient and ICU level medicine over the years, and at times, including now, predominantly in the outpatient setting. So I've kind of seen both ends of that spectrum. In this job here, a lot of the patients that arrive at our facility are in need of additional testing. So in other words, they would go see a medical oncologist and have to be turned around for more testing and then return for what you would call the treatment conversations. So part of my role is to make their time more efficient with them. And that's the bulk of what I'm doing right now, but there's still some they run into, medical challenges with our patients in the outpatient clinics, and because a number of our patients travel, and certainly that's been impacted with this in our facility. They don't have a local doctor, so I become their de facto on-the-spot PCP. So that's kind of the role that I take here in the hospital. The administrative stuff is, through my career, I've just sort of migrated towards that. In my prior position, I was the head of a 140,000 square foot outpatient facility. So it was almost like a hospital. It was a really large center. And then coming here, I just kind of gravitate to that. I always feel that my job is to make everybody else's job easier, and administratively I can do that, and clinically I can do that. So that's me. COVID in our hospital and every hospital has been, as it has been for churches, it's a game changer. We have seen changes in terms of how the flow of patients arriving at our facility, the precautions that we've had to take. Telemedicine went from 2% of our enterprise's practice to almost 100% overnight. Some of the changes that occurred through federal leadership to telemedicine opened it up. I could talk about that for an hour, but probably not the goal here. But they allowed us a lot more liberty. I don't have to be licensed in 17 states because we're bringing a patient from New Mexico. I don't have a New Mexico license. I can't do telemedicine. So those restrictions were all waived, all lifted. So I fundamentally believe the ship has sailed on telemedicine. I'm hopeful that government continues to allow it, because it's been an awesome thing. And I think as churches move through this and you guys identify ways that this new electronic resource, or at least this more robust electronic resource has abruptly presented itself as it did to us, I think there's opportunity there. Whenever there's any level of engagement, there's opportunity, and I think it's going to be critical both probably in every phase of everyone's life. There's going to be opportunity there. So But we went to things like single point of entry to our facility. Everybody was screened coming in with infrared thermometers. Everybody's masked, still doing that. There's questionnaires. Anybody that screens positive is isolated. One of our hospitalists comes down and we do a rapid COVID test, which we can usually get the result within an hour. And if those individuals test positive, then those are ones obviously that we're moving out of the facility and trying to accommodate them in other ways. Anybody that's going to be in our inpatient unit is screened at the time of admission or before admission. Any elective surgeries that are going to be done currently, they're all screened beforehand within 24 hours of the procedure. If we know they're going to be admitted, then we've already taken care of that. We canceled hundreds of elective surgeries. Now, in our world, the cancer world, there's, and this is something else that's kind of bubbled up. You had this idea of elective surgeries, and then you had emergent surgeries. But now we have this sort of new entity that's been defined, which is urgent surgeries. So, if somebody has a cancer, a tumor that needs to be removed, and it's in timing with chemotherapy or just timeliness of treatment, our unofficial mantra has been, cancer is not going to wait for COVID. So we need to figure out a way to accommodate that patient and take care of them. So we didn't cancel as much as some, tertiary care hospitals and those kind of things, but still we canceled a lot of elective reconstructive surgeries and things of that nature. So it's been hugely impactful every phase of the game, and we're still, a little bit buttoned up at this point.
Yeah, well, and it's interesting to see, you talk about telemedicine, that ship has sailed and hopefully it has. And yeah. It's just another indication of how much, technology has changed the way that we do things. And of course, on our end with churches, when it comes to, streaming services or online experiences, yeah, that ship has sailed, for us. And it's like, that's not going away. So the question I just to kick it off here, what would you say that doctors, nurses, other medical professionals, when they come, when churches are reopening, right? And everyone's like, how do we do this right? And there's some churches that already have started that. I know Compass is going to start kind of moderately doing some stuff on Sunday. But what are you guys looking for when you walk into a church? What do you want to see? What do you want to hear? What's going to signal to you that the leadership has done an effective job in creating an environment that you would feel comfortable bringing your kids to, that you'd feel comfortable bringing your parents to? What are you guys looking for?
Again, big, broad question. There are, number one, just in terms of the population that's coming to the church, and these are always going to be individual choices. But if I, had the magic wand and I could kind of control that, I would probably encourage people over the age of 65 and certainly over the age of 85 to be very thoughtful about that, and understanding that if they acquire the infection, they're going to be at greater risk. And that's just again, this is much of this is my own opinion. So everyone online, please understand that. But, I think you want to be thoughtful about that. And we want to make sure that we're, if they haven't already been educated, that people are aware that, if you have underlying medical conditions, if you're of a certain age, that you would theoretically be at increased risk. So again, every individual needs to be thoughtful about their own risk level, number one. As far as the physical structure, the obvious answers are, social distancing. We talk about 6 feet. You can talk about orientation of chairs. You don't want face-to-face, sort of orientation in any way. That's not typical of most churches, but not knowing everybody's layout, you would want to avoid those types of things. I kind of chuckle when you first asked the question. I imagine like showers of hand sanitizer as you walk into the building, right? You just get coated with cleansing agent. But in all seriousness, when people come in and they're going to be touching surfaces in the church, I would think having that sort of thing, obviously with an individual, a volunteer, sort of dispense, kind of thing as people walk in, just to make sure everybody's hands have been cleaned off before they come into the building. Again, masks are going to be a sometimes state mandated thing, a sometimes personal choice. My own feeling on it is, masks are absolutely the masks that are out there. Although I see some people with, N95 and N99 masks out in public, Those masks, the N95 and N99, and the 95 means it blocks 95% of the small particles. N99 obviously is 99%. The masks that most of us wear out and about and doing those things are really more about in case you are an asymptomatic shedder of the virus, that you are mitigating your opportunity to spread that, both in terms of volume and proximity with people. So masking, if asking a congregation to do that or be thoughtful about it is certainly a reasonable request. But I think the hand sanitizers, the spacing, the orientation of the seating, and being mindful, each individual being mindful about their own relative risk would be the things that I would stress.
So in communicating that, going back to the mask thing, and it's obviously, it's so funny because it's almost become a political thing now, like everything does. So without trying to go down that road, you mentioned different types of masks. What should the leadership say to the congregation about masks in your opinion? I mean, it seemed like seemed like it was a little more optional in your mind.
My recommendation would be that people wear them.
Okay.
That would be my recommendation. You're putting, 100 people, at least Arizona, we can get 100 people in large group gatherings at this point with distancing. That's a lot of people in a small space. And again, masks, we can debate the effectiveness of it anecdotally. We can debate the scientific evidence behind it. They're not perfect, but to me, it's about it's a value proposition. And I say this all the time to patients. When we talk about a treatment, we talk about the possible adverse effects of it. To me, it's a potentially, if it stops one spread, again, that's the unmeasurable, you'll never know. But if you stop one spread, it's an extremely high reward versus pretty minimal risk in that. Totally understanding that nobody wants church to become this robotic, kind of altered reality. But to me, it's a low risk. It's a low ask, but it's potentially a high yield thing for an individual to do to fundamentally protect other people.
Yeah, and I think and obviously churches, it feels like they have been singled out in certain, and we got some great questions coming through. Just by the way, those of you guys writing questions, we're going to get to those. They're great questions. But on the subject of even just being together in a large group, I think one of the distinctions that we have to be honest about is that when we are going to a church service, we're all together in the same room for an extended period of time. It's not like, you're just breezing through somewhere. And I don't even know, I don't know all the science of how it can be transmitted or how long and that sort of thing. But is that a legitimate concern that you're putting a bunch of people into a room that's a closed space for an hour plus, and that could raise the, you know what I'm saying?
Yeah. So and again, it's unfortunately a very black and white answer. The risk is 0% if you don't meet, for that to occur. In meeting, there has to be some risk of it. And so there's many layers to this. So many other things are coming out of COVID from a medical standpoint. When you look at issues with alcoholism, drug abuse, suicide rates, all of these things, you have to kind of factor all that in. And with obviously the huge majority of congregants in our churches, this is a source of stability and strength for them. And to have that taken away, even though we're offering it in alternate methods, for some individuals, that's not enough. So there's always that overall, in cancer, we always talk about overall mortality and cancer-related mortalities and these kind of things. So overall impact versus impact on the church is something that's going to be very, very difficult to evaluate. But I think you have to, we're in a position now where I would recommend we start to move forward with things. But again, being very, very thoughtful about it. I don't love the idea of, a 90-year-old couple coming to our church and sitting in there for an hour with 98 other people. Like that is, is it going to be okay for them almost every time? Yes. But if something were to happen, could that easily be viewed as an unnecessary risk for those individuals? Now, again, then you get into, as you said, politics, life, liberty, and the pursuit of happiness, and all those things. And I totally get all of that. But from a purely medical perspective, moving ahead, I think is reasonable. Reopening churches, I think, is reasonable. But, nobody needs to be cavalier right now. I do have to chuckle sometimes when I hear, this whole thing is overblown. And, maybe it's been overblown in certain aspects and in certain ways and with implementation of certain policies and things. But at the same time, there's a reason that there were, free refrigerator trucks lining the streets of New York City around hospitals. Temporary morgues happened. So this has, huge potential impact. And the hardest part is we don't even know what the incidence of this disease is. People keep comparing it to the flu. Honestly, I didn't look today, but in the United States, we're approaching 100,000 COVID-related deaths. You can then argue about the veracity of those statistics because what's a COVID death? There's definitely some judgment calls that occur that maybe somebody happened to have a heart attack as part of that illness and, it gets lumped as a COVID death, but they're approaching 100,000 deaths. It's not unheard of for us to have 60,000+ deaths in an annual flu season. So in totality, it doesn't sound that bad, but the bigger concern is what's the true infection rate? So you really can't even estimate accurately what the death rate is with this disease because we don't know. And the CDC actually last evening released a pretty dire commentary on the antibody testing, which is now becoming, that's what people were thinking if you test. So normally when we test, it's what's called a PCR, where you take a swab and you're literally looking for viral RNA. So is there actual RNA in the nose? That's where we do the testing. Now they're talking about antibody testing or serology testing. What that is, you're taking a blood sample to see, have I developed antibodies to whatever was in my nose previously. And those tests, they're talking not only about false negatives, but a lot of false positives with those tests. So that was a little bit disheartening to read that last night because people were sort of holding on to that thinking, okay, well, if I have the antibodies, then I'm good. I can just go live my life and I don't have to be afraid. We have no idea about the level of immunity that comes with that. So having an antibody level, in other words, with this virus, we don't yet know what is adequate antibody level protection. If a person gets hepatitis B immunization, and you should always check a titer at the end of doing that. And some people will have a titer, but it's not adequate. So you have to re-immunize them. You have to re-challenge them to get it up. In this case, we don't even really know what the target is. We can just assess whether or not there's antibodies there.
Yeah.
So it's tough.
Yeah. And, and so what I love what you're saying because on the one hand, from a doctor's perspective, you're saying, hey, look, you of course you see the world through that lens, which is why we want to have you on, but you're also able to say, hey, on balance, I think we should try to begin to move forward. And I think that's good. So we've got a bunch that people have questions for you, Doc. So here we go. Would you recommend outdoor gatherings if possible? Like we have a lot of SoCal churches. We have a lot of churches that are in great weather areas that any time of the day.
So not in Arizona, since I'm going to be there on Sunday. I don't want to sit outside and swelter. I'm kidding, but yeah, outdoor. So having obviously airflow, those kind of things. Again, depending, it's really hard to get into efficacy, but do churches purchase, these micro HEPA filters that filter out 99% of airborne particles? Those are considerations that churches could consider. But as far as outdoor, I think absolutely.
Hang on, I want to stop you. That was important what you just said. Churches could consider buying masks.
Yeah.
I went to Nordstrom to walk through to get to the mall because we decided to take the kids to the mall, which is a weird experience. It was kind of post-apocalyptic. But they're had these little tongs, and they were handing out masks as you walked in. You could take one. That's something that churches could do, and you could get the 95s or whatever, right?
Are you talking about the masks?
Yeah, right.
Yeah, so again, an N95, an N95 or an N99 mask will not only prevent you from aerosolizing, and again, there's great debate about, somebody coughs, is 6 feet enough? We've all seen the YouTube videos, right? Somebody sneezes and you just have this whole cascade of particles. But the N95 and the N99 are different from the surgical mask or the cloth mask that most people are using. The cloth masks are really about you protecting other people. The N95s and N99s not only are going to protect other people because they're keeping your droplets in, so to speak, but they're going to protect you from breathing things through the filter because it's just a much more adequate filtration. Now, those are supposed to be fitted correctly, and you do what's called fit testing. But again, this isn't about, oh, did I do my fit? I can't wear it if I did. It's about common sense and doing everything you can, reasonably so, to protect yourself, protect your family, protect your congregation.
So here's the big question that on a lot of people's minds. It's become somewhat of a controversy. It was in New Mexico, and that is the issue of singing. Okay. Yep. So from your perspective, what do you think about singing in a church?
So hopefully nobody has any virtual tomatoes here, but I would not recommend that at all. I would not recommend that the congregation be engaged in singing, and the reason is this. When we look at medical procedures, we kind of look at it the same way. There are medical procedures that we do that are what we call aerosolizing procedures. So if I'm going to intubate somebody, clearly, there's going to be gag reflex, there's going to be coughing, there's going to be particles that go up as a result of that. We know and these are not recent study, I mean, these have been around a while, but we know with exponentially increasing your voice, your volume, you produce more particles. With coughing, you're again talking about producing those things. Sneezing is even worse. And actually vomiting is one of the worst things that can occur because it's just such a forceful thing that there's a tremendous amount of respiratory droplets that come out with that as well. It's anecdotal, Tim, and it's always hard to be take an epidemiologic look at this stuff and say, okay, well, in Washington State, there was back in March a group that met for choir practice, and it was sort of at the onset of the rules, if you will. And so they avoided handshakes and they used hand sanitizer, and nobody was symptomatic. They practiced for about 2.5 hours, and I think it was around 80 people or 70 or 80 people. 52 of them within 2 weeks were positive for COVID, and 2 of those individuals, unfortunately succumbed as a result of it. Was that a direct result of that event? It's certainly suspicious, again, from an epidemiologic standpoint, when you look at contact tracing and mapping and the patterns of exposure that those individuals had. And like you said, there's been other states with reports of this. Absolutely 100% singing, deep inspiration, singing, doing those kind of things, you are going to aerosolize a lot more than you do just with restful breathing. So again, purely from a medical standpoint, I could never recommend right now that we do that, because to me it's an unnecessary risk. I can worship God quietly with my hands on my heart, my eyes closed, and listen to a beautiful song. And again, it's my own personal opinion. I take as much pleasure in doing that. Actually, it's more pleasurable because I don't have to hear myself. I'm a terrible singer, but that's why I'm glad it's nice and loud. But I mean, again, that to me is so as leaders in the congregations, I think there's going to have to be some decisions. And again, they're personal decisions. Medically, it's an unnecessary risk, in my opinion. But then it's all on how you sell it to them. We want everyone to be safe. We want to ensure, but we're absolutely going to worship. We're going to do it in this way. And I just want you to be quiet and mindful and, just meditate on the words of the song. I mean, to me, that sounds awesome. I'd like to do that just once in a while anyway. But again, these are always tough personal decisions.
Well, and it kind of goes back to the first question I asked you, which those are the pastors and leaders, we have medical professionals, doctors, nurses, people coming into the service. They're looking for certain things. And, one of the things that we want to do is make sure that we have taken the right precautions and thought it through those kinds of things. And so, in other words, when it comes to singing, you're saying that, you walk into a church and they make a statement like, hey, we know you love singing, but just out of an abundance of caution, we've consulted with other medical professionals. Right now, we just this is how we're going to do it. That signals to you that this church is mindful of the risks and is trying to be sensitive, right? I mean, is that
it absolutely does. However, this group is a cross section of society, and obviously there's commonality and there's some skewedness in that. Doctors are a cross-section of society. Nurses are a cross-section of society. So you're going to have people that will, let's say at church, enforces masks, no singing, just the sort of the full court press. Just as you see at the grocery store and just as you see out and about, you're going to have people that walk in and say, this is ridiculous. I had a person kind of reach out to me recently and said, we're letting the enemy win. And, in my mind, I talked to that individual. In my opinion, it's, exercising caution when there's a known entity or concern, and seeking discernment and guidance and implementing a plan is not allowing the enemy to win. That's kind of how I message it to the individual. But point is, there's people that if we sort of lay down the sword in any aspect of this, you're going to have people that will be hypercritical of you. And if you are too far the other way in somebody's opinion, then you're going to have people that'll be hypercritical. And I say that when you say professionals coming in, there's tremendous debate in the medical world about what is right. So again, my point is always, err on the side of caution, never being disrespectful, never dishonoring what you're trying to accomplish in church or work or anywhere else. But at the same time, if I'm going to go see a patient and I do this, is this a huge cost for me? Is this a big deal? To me, it's not a big deal. So that, and it might, I'm not saying it will, but it might protect someone else. So that's why I would recommend it. But you're always going to have people that are critical of you, no matter what you do.
Well, yeah. And I think, again, it's helpful for us to hear you say this too, because, you're in that world and you see the great diversity. And there's also an understanding that you have to have that, I appreciate the humility too, because sometimes, and part of the reason why we're glad you're not an epidemiologist, no offense to epidemiologists, but it's the old thing, when all you have is a hammer, the whole world looks like a nail, right? Yeah. And so it's like, you have to be able to see other things. By the way, I think I got confused on something. There was this, you were talking about HEPA filters or something, and I related it back. I got. Yeah.
So outdoors, again, from a speculative, but relatively evidence-based perspective, an outdoor gathering, it's like sitting on an airplane. If the filters aren't running and you're all sitting in the tube breathing, there's a pretty much higher probability of particle dissemination and mixing. If you're outdoors, again, I would say common sense would tell you, if nothing else, that there's going to be less of a risk there, because you're going to have a lot more fresh air, so to speak. There's air circulating through. It's not the same stagnant air environment.
Yeah. Okay.
I think that's a great idea. And again, like right now, for the people that are so craving to get back to corporate, in-person corporate worship, I think, compromising and finding ways to do that is a great way. And if you can do it outside, I think that'd be awesome.
Mm-hmm. Mm-hmm. Yeah. And there's definitely, we have a lot of people in that situation who realistically, can do that. So I just heard that your wife has joined us. So
Woo!
Dr. Cynthia, are you there?
I am. Sorry, I was a little bit late.
No, that's okay. We're see, the thing is, we're catching you guys mid-shift. You guys are working, and you're taking care of patients, and you had enough, you graciously stepped away from that to give us some time. So we really appreciate it. And so far, we've been talking about a variety of different things. I think so. Here's a question I'll throw at you to throw you into the conversation here, Doc. Nick is asking, California guidelines recommend kids stay with parents at all times. When we look at reopening church, and one of the biggest challenges for churches, this has been children's ministry. What do you do? Do you have any thoughts on kids playing together? What do you think about that?
Mm-hmm. Yeah, I think it's, primarily, again, it's the risk of transmission that, you're concerned about. I have 4 kids myself. Obviously, 2 are a little bit older, college age, but we've got, 2 in middle school. And from the perspective of, probably Steve has probably said it several times, there's a lot that we still don't know. And some, from a medical standpoint, we always have we always state, do no harm. So I always think of my kids and wanting to keep them as safe as possible. And if I'm going to put us in a situation that is at all at risk, I want to make sure that the benefits of doing that activity or whatever it is they're participating in far outweigh any risks to their health. And so at this point in time, because I feel that there are so many unknowns, I don't know that I would want to throw my kids into a classroom with a lot of other children at this point in time. I just don't know that, they're able to get, I think it's very important for them to continue to grow as Christians and get that, being fed that information and getting Sunday school lessons and things like that. But I can, we're able to do that from home right now. I feel like we're still doing that. Even the younger ones are watching the church service with us online. And so I feel like I'm still able to provide and nurture their that aspect of their life. But to say that I think that they need to go and be in person and in a classroom with a lot of other kids where they might contract something, and then not only do you worry about them contracting something, but then passing it on to others, that I don't know at this time point that I feel that the benefits of doing that outweigh, the potential risks when there are so many still questions to be answered about that. And unfortunately, we're seeing now, even complications, whereas it was initially felt mostly it was older individuals with certain medical conditions who are at risk. Now we're seeing some complications in kids. And honestly, I always ask this all day long. I tell patients all I do, I give, I'm an oncologist, so I give chemotherapy. So we're always weighing what are the risks and what are the benefits, always when making sure those benefits far outweigh any risks of something we're doing. That, if my child contracted something, would I feel like, well, it was worth it, they needed to go there, they needed to do that? I don't know that I could say yes at this point until we have a little bit more information. I think as things are opening up, we'll be able to see that, whereas individuals are going out a little bit more, and we'll see, is there a spike again, or does it seem that things are settling down a bit? But I know it's a long answer to that question, but that's kind of how I look at things and assess them.
Hey, Tim, if I just one sentence add, it goes back to, again, the population that is coming into the church. We talked about over 65, there's an incremental risk, over 85 even more so. Kids, I would probably not advocate for that. Especially you get into families, there's so much more mixing that's going to occur in a kid's environment, and then it's that cross-generational exposure and things that, to me, would be an unnecessary risk as part of step one.
Yeah. Well, so again, that's good. So trying to get to some of the other questions here. Al is asking, any thoughts on the need to disinfect fabric chairs? Is that, most of our churches, we don't have leather seats, fabric seats. And so, stuff gets in there. What do you think? Cynthia, what do you think?
Yeah, Cynthia. Good.
Oh, I don't know. That's a tough one. I think if there's a way that you could, that would be, ideal. Certainly, we know that the virus can survive, on surfaces. Obviously, cloth's a lot harder to clean than, a solid surface would be. So I would say, I think if you're able to do that, that would be great. I just don't know what all is available, currently for, the public to use.
Yeah, per CDC anyway, they talk about most available over-the-counter, and that's a direct quote. Most available over-the-counter disinfectants are effective against the virus. So could you spray them, lightly with like a Lysol, a nicely scented Lysol spray, and just sort of let that dry on the fabric? Nobody can speak to the efficacy of that, but to me, again, is that something that somebody could do relatively quickly that might be of benefit? Theoretically, yes. But to Cynthia's point, cloth is a little tricky. But wiping down surfaces, touch points, doorknobs, bench railings, handles, all that stuff is a no-brainer. And again, that's why I think having a greeter with a pump, so everybody's hands are theoretically clean the moment they walk into the church is honestly, probably if we could pick one thing, that's the one I would pick. But the wiping down of surfaces in the church, even if they're cloth, even if you can't wipe it down, can you sort of spray a layer that's not going to wreck the material or whatever? Then yeah, it's hard to argue that wouldn't be a reasonable thing to do.
Yeah.
Don't pour bleach all over your seats, though. That's controversial. We don't want to do that.
No, yeah, that's a bad idea.
Bit overkill.
So here's another aspect of this. What can we do as ministry leaders to engage the medical professionals in helping us, with reopening weekend services? I mean, like, should we, it's kind of like one question came up actually before this, like, hey, we have a lot of churches have security teams, they have like paramedic teams or whatever. Should we have like an on-call nurse or something, or are there ways that we can, how could we involve you guys in our efforts to create this safe environment?
Well, certainly doing something like this, I hope you guys find it helpful. I mean, sometimes we feel like, you're talking about epidemiologists. I was chuckling in my head. I'm thinking they've proved they don't know anything so far, right? Because, I mean, and I'm kidding when I say that. It's just, I have uncertainty as a physician because I read the literature, and the literature is uncertain. In medicine, we're used to evidence-based practices. You don't talk about ramping up a vaccine in 6 months, ever. You've got to do a, randomized, blinded, prospective study where there's equal exposure in the group to prove that a vaccine is effective. I mean, that's a year process normally before you would ever be able to do something like that, and probably even longer. But we're talking about doing things that are more anecdotal, we're throwing medicines at this stuff left and right. I mean, you guys have seen all, remdesivir, hydroxychloroquine, there's all these different medicines that are labeled as, the potential savior, but yet, it ultimately seems like it's more anecdotal and not really an effective therapy. But I think, Tim, it's communication. It's just relying and leaning in. We lean into you guys constantly. I think sometimes just sort of leaning back would be appropriate, but I would just always couch it with the caveat that, understanding whoever you're talking to, no matter their professional background, they may be extremely skewed one way or the other, as you said, because of political views or because of, their own personal experience. I read something online the other day about a woman who was heckled. She was wearing a mask, and, the backstory was she had the H1N1, that pandemic years ago, and she almost died. She was on a ventilator and she was sick. So she was going to wear her mask and she was being ridiculed for it. So it's just, there's so much, unfortunately, and again, if that's a lesson, make sure you separate the wheat from the chaff here, if you pardon the expression. Just, keep it back to what we know. When you make decisions about this stuff, you have to go by what we know. And unfortunately, right now, we don't know a lot.
Yeah.
So again, use caution.
Good. So a couple of questions are coming through that people want to know. Should the church either screen people, take their temperature, or even, ask that they take their temperature at home before coming to the church service? Cynthia, what do you think about that?
Yeah, I think that's a very reasonable thing to ask them to take their temperature at home. I know at the hospital here we do, I don't know, Steve has already mentioned, a single point entry where they are screening everyone, employees and patients alike, just with a quick thermometer that doesn't touch the head, doesn't make any skin contact, screening for temperatures. I would hope that people would be relatively reliable in doing that, checking. I don't know how feasible it is to check groups of people coming onto campus, honestly. Coming through the front door is one thing. There's individuals streaming through where you can kind of screen everyone. It might be a little bit harder to do something like that on a church campus. But I think, very reasonable to ask ask individuals coming to church to screen at home ahead of time, kind of listing any symptoms or things that that they may want to, stay home if they're experiencing any symptoms like cough, obviously fevers, symptoms that may be related to the virus. So yeah, again, it's kind of one of those things that just makes good sense to do, and it's relatively easy to do, to get that message out that, hey, we want to ensure the safety of everyone on campus. So please, if you have any of these symptoms or any family members you've been in contact with have these symptoms, please, join us, join us online.
Yeah. And again, I mean, for some of us, screening people as they walk in might feel a little bit draconian, and
Yeah.
it just may not,
Mhm.
it just makes you guys, what I love about this whole conversation we're having is that there really is we're not talking about this in a vacuum. You're incorporating multiple dimensions, even Steve, going back to what you were saying about, hey, listen, people need to go to church so they don't kill themselves or they don't get really depressed. There's other, it's a holistic approach that we just have to manage the risk. But, going back to something else, Bob Osborne, who's on our staff, has been so helpful to so many of us in just the stuff that he's written about a lot of this. And one of the things that he's been recommending is that, a church that opens should designate like one leader and but not the pastor, not even a staff member, to have one responsibility, and that is to lead and manage and oversee the health and sanitation protocols and make sure they're followed. I mean, what do you think? What do you think about something like that? Like, hey, if you designated one person, it's their job to kind of be the, I hate to say this, but like the health Nazi, in a sense, if that, hopefully that's not insulting to you guys, but that to play that kind of a role.
And to me, it's, the parallel in hospitals and many public buildings is you're required to have an infection prevention specialist. So, that sort of role, at least it provides an official resource for the leaders of the church. To your point, how do we engage healthcare professionals? I would imagine in most institutions, there's somebody with some healthcare background. In fact, I bet it's universal. And so designating somebody in that church that can be a resource to the pastoral staff, to the regular staff, to the leadership boards, all of those would be an opportunity for that individual to engage with them. So again, not to borrow your term, Tim, we don't want to be draconian about any of this stuff, but it doesn't have to be some front-facing role where they are the health police, but it's more of a resource role for the church, and they could help give some guidance, and hopefully with future issues as they arise, it's a little more clear guidance, than this current situation. But
Well,
the only thing I would add to that is I don't know that I think it would necessarily be a good idea to kind of identify one person and say you're overseeing that. I think that's kind of, most churches probably may not have a resource of someone who's kind of an expert in that area, who's getting updates frequently and things like that. And so I think sometimes labeling someone as the local expert who's overseeing this, if they don't have the skills and resources to do that, that's kind of a lot of pressure on someone. And if they're making bad decisions, maybe they're misinformed, and they're making what they feel is a good decision from the heart may not be evidence-based or backed up by that. I think more so maybe kind of like you said, just engaging healthcare professionals in the services, and that to say, hey, please keep your eyes open and look for things. I think maybe doing it more in a general sense as opposed to having one identified person who does that. If your church has a resource who's someone who's very up to date, and that you might want to go to them more so than than just other healthcare providers. But I think if you don't have that resource, maybe just to engage people who are in the healthcare profession to have their eyes and ears open, looking for opportunities to improve sanitation and improve safety measures without necessarily labeling someone as overseeing that.
Right. So you don't necessarily need to do that, but I think the idea of having somebody that could it's kind of like, again, going back to the security, the job of the security guy, like you're as a pastor, you're trying to look around, you're trying to engage people and, whatever, and say hi and preaching, and the worship people are doing their thing. But then the security guys, his one job is just to look around. So this person, I maybe just having people designated, or one person designated, however, to just kind of make sure that they're owning that part of it. Because, it just makes sense from a leadership perspective to do that. But I think that's a good caveat too, is you don't want to build that person up like their advice, their specialization is the best. So the other thing too is, obviously, and I think a few comments have come in through about what Los Angeles County is requiring. And see, that's the amazing thing about all of this, is there's such a diversity of, you know, it's like places like Los Angeles County are probably gonna be the strictest, or maybe a few other places as well in California. Whereas, you know, in Arizona, it's just not as much. So you have to put more of those restrictions in more voluntarily to make sure that you're doing, you know, the best job you can, kind of like what you said, you know, do no harm. So you know, we've only got a few minutes left here. I want to ask you, what are some things that we can do as pastors? You know, what are you guys wrestling with right now? What's the best way to minister to you guys in your profession? How do we help care for you? Because, you know, you hear some of these stories, and I know a lot of you guys are working real hard, and what's the best way to minister to you and those that are in your profession right now?
I always find that prayer is is the best thing in situations like that. I think, you know, I definitely believe in the power of prayer and can feel it. You know, we've been through, you know, Steve and I have had big challenges in our life with, you know, children that have had major medical conditions. And I can tell you, you know, the peace that comes over you just from knowing that other individuals are praying for you, I think that is the greatest thing that, you know, that we can receive from everyone is being lifted up in prayer. And I would say, I think, you know, the biggest things we're struggling with, I would say, you know, fatigue, just with the way things are currently. It's every day feels like a time crunch. I know, kind of feel like we're on the hamster wheel, and then you get to sleep and you wake up to the same thing. So it has been a lot more time consuming providing care to patients, you know, during COVID. And so I think it's just, you know, those are the things that we're kind of struggling with. Some, you know, individuals are struggling with that idea of not only fear for their own health or, you know, acquiring infections, but, you know, you worry about going home to your families and am I going to get my children sick because I'm out being exposed to patients and that. So those are the, you know, the big things that I would say people are struggling with, you know, fatigue and you know, fear of the infection and of spreading it to others and their loved ones. But I think, you know, prayer and you know, a specific prayer for things like that is what I think we appreciate. And then certainly being able to come and watch services, whether it be live or online. I will say our church has done a tremendous job at keeping us feeling connected. And I think, you know, continuing to nourish our spirit through, you know, through worship.
Yeah. Steve, any comments on that?
100% agree with it. That isn't obvious. And then I think it's just about, you know, relationships in the church, you know, indirectly having a healthy church environment where you have, you know, nourishment occurring in, you know, not just in the Sunday quote unquote model where you have those relationships built into your church. You know, I get texts all the time from people in my connection group that, hey, you doing okay? Thinking about you guys. How are you doing? So that, you know, the church, again, to the point earlier, you know, doctors, we're just a cross section of society. So there's going to be people that walk through this and they're totally fine and it never bothers them. To be frank, you know, I've seen individuals effectively resign out of fear, and they're taking leaves of absences, you know, from work right now. And, you know, we can debate that whole thing, but point being that people are going to react differently. You know, you go to love languages and those kind of things. People are going to respond to things differently, different encouragement. But again, prayer, absolutely all day, every day. And then I think just making sure that, you know, we're still being the church, you know, and that's not a single individual's or pastoral staff's job alone at all. But I think just being the church and you know, that's what we need, just like you need, and just like everybody else needs. So. Yeah.
You know, I love how you said that, because we expect doctors to, you know, you have the coat, you have the prefix, you have the degrees. And we've elevated you guys, and you know, you guys work hard. You spend a lot of time training, but at the same time, that can also be like, you know, when do you need help? When do you need to be cared for and prayed for? And, you know, a note written to you and an email or a text, hey, praying for you today. Because to hear you say, and we know there was one doctor, there's only one, but I mean, still, it's a tragedy who committed suicide because of the stress or whatever else of all this stuff. And you just don't want to see that sort of thing. you guys have your own issues that you're dealing with while you're trying to care for others. And we do have similarities in our jobs in that we are both in the helping professions, right? And it requires, it's a lifestyle of sacrifice. And so we have to have that self-watch, that self-care. You guys certainly need that. Last question, because we have a couple minutes. Do you know, well, I just want to, Bob Evans asked about, and just answer this really quickly. You know, I know there's some fear about contact tracing and that sort of thing. Are you, any thoughts on that?
Yeah. So that, you know, again, if all things being practical, if you could have, you know, like seat, and I've read articles on this, like seat mapping and understanding who sat where, and then 3 days later, this person tests positive. So then, you know, we're going to look at that group a little bit more intimately. Fundamentally, I'd say you look at everybody in the building if a person tests positive. So, you know, honestly, depending upon the size of a facility and those sort of things, I don't know that, you know, mapping out exactly where a person sat and keeping logs and all that stuff, but you would certainly want to keep attendance for individuals that were on campus for a service on a certain date. And then, you know, again, part of that request to the congregation, hey, let's be safe. You know, if you're comfortable, wear a mask. Please avoid singing. If you are going to be here, we're going to record attendance this date. And if you get sick, please just let us know. And, you know, then you take that information, you go from there. And if they're sick, you know, their testing is available now, you know, certainly for the rapid testing in most areas. You know, that individual could be tested, and if they're negative, you know, then we relax on that information. If they turn out positive, then again, I think you want to share it with the people that were in attendance, you know, just as if nothing more than a common courtesy. So you know, there certainly are facilities that are mapping this, you know, like I said, to the seat. I personally don't know that I would take it to that level. You know, in some of the Far Eastern countries, you know, with you know, cell phones and all these things, you know, there's a lot more intricate. Interesting, in Taiwan, they have, you know, they've done a really great job, you know, with masking and tracking of mitigating spread in that country, and a lot of it's done through electronic tracking, contact tracking. But you know, then you're right back into that whole political debate, and you know, that's a hot potato. But again, anecdotally, one country, one set of data. It looks, if that's what they're doing, and it seems to be pretty effective. And you know, for people that are then in that contact exposure, there's automatic quarantines. You know, they're shutting them down for 2 weeks, and you know, based on the outcomes to date, it's a very interesting philosophy. So again, more data is always helpful. So I would want to know who's in attendance. You know, and I think that's a reasonable thing.
And I'm glad you brought that up, because you know that, and then we have to walk that line with privacy and all kinds of stuff. And there's some fear about turning those, you know, things over to the government, and there's that whole debate. And so you guys, obviously there's a lot of wisdom there. So I mean, we're 59 minutes in. I can't believe how fast this thing went. You guys have to get back to work. I want to say thank you so much for taking time out of your schedule to be with us. It's just very helpful, especially your perspective, because you're involved in multiple levels. You know, you're volunteering at the church, you're in leadership, you know, and so I really appreciate it. I'm going to ask Matt Patterson. I'm putting him on the spot. Matt, would you close us in prayer today? Just and pray over us, pray over these doctors, for Stephen and Cynthia. And I just really appreciate that. Thanks.
Glad to do it. God, we thank you so much for giving minds and the abilities for doctors like Stephen and Cynthia, and just thanks for also their hearts for you and their hearts for your people. We just pray your blessing over them, for their family, for the patients that they will see today, for the difficult situations beyond COVID-19 that they face every day. Lord, I just pray your hand of protection, your hand of peace over them, and help us as churches, Lord, as ministry leaders, as we consider your wisdom in all this, Lord, recognizing that you are sovereign, Lord, you are the great physician, and we recognize your hand in all of this and want to follow your lead. So give us wisdom, Lord. Give us faith. Help us to operate prudently, wanting to care for our church members, and just pray that you would guide us and help us to not buy into what the world is doing and feel rushed or pulled in any one direction or another, but rather be led by your Spirit. And so we just pray for the decisions that we made in the weeks and months to come, and just pray for your, above all, that we bring you glory in what we do. In Jesus' name, amen.